All right, let's jump right in. Today, we're taking a really high-yield tour through the fundamentals of psychiatry. We're going to go from the mind's hidden defenses all the way down to the actual molecules that can help bring things back into balance. So, this is the big question that's going to guide us through everything today. First, we'll explore the brilliant, totally unconscious software our minds use to cope with, well, reality. Then we'll get into what happens when that system breaks down, leading to major psychiatric disorders. And of course, the treatments designed to help. Okay, so first up, let's talk about what's basically our psychological immune system. These things we call ego defenses. You can think of them as automatic programs that are always running in the background, protecting us every single day without us even knowing it. Think of your ego as this constant negotiator. On one shoulder, you've got your primal urges, what Freud called the id, saying, I want it now. And on the other shoulder, you have the superego, which is like this internalized rulebook from society and your upbringing. Ego defenses are just the clever, unconscious tricks the ego uses to settle that fight and keep your anxiety from spiraling. Now, these defenses aren't all created equal. They exist on this huge spectrum. At the, let's say, less sophisticated end, you have something like denial, which basically just ignores reality. You know, the classic case of someone with a serious drinking problem who swears they just have a drink or two socially. But way over on the other, much more adaptive end, you get something like sublimation. This is where you take a potentially negative impulse, like aggression, and channel it into something awesome and constructive, like becoming a disciplined, successful boxer. If you want a really high-yield way to remember the healthiest, most mature defenses, just think of the mnemonic SASH. We've already covered sublimation. Altruism is when you deal with your own stress by focusing on helping somebody else. Suppression is interesting because it's the one that's actually conscious. You're actively deciding to put a worry on a shelf to deal with it later. And of course, humor, finding a way to laugh at a really stressful situation. I think every medical student cramming for boards knows that one intimately. So that's how things are supposed to work. But what happens when those psychological and biological systems just get pushed way past their breaking point? Well, that's when we start to see the clinical psychiatric disorders we hear about. Okay, when it comes to mood disorders, this right here is probably the most critical distinction you need to know for diagnostics. The dividing line is mania. You can have depression in both conditions, sure, but for a diagnosis of bipolar 1 disorder, there must be a history of at least one true manic episode. If there's ever been one, it's bipolar 1. If there's never been one, it's major depressive disorder. It is that definitive. Mania is the line in the sand. And here is another absolutely critical distinction, but this time it's for psychotic disorders. The symptoms, they can look exactly the same, but the diagnosis, it all comes down to the calendar. If all the signs and symptoms of schizophrenia are there, but they last for less than 6 months, we call it schizoformiform disorder. The second it crosses that 6-month line, the diagnosis becomes schizophrenia. The timeline is literally everything. Now, when we talk about the symptoms of schizophrenia, we split them into 2 buckets. Positive symptoms are things that are added to a person's experience of reality. Think hallucinations, delusions, things that weren't there before. Negative symptoms are the opposite. They are things that are lost or taken away from normal functioning. Things like losing emotional expression, losing motivation, or losing the ability to feel pleasure. It's a really fundamental way to understand the illness. Okay, so we've talked a lot about the mind. Now let's pivot and talk about the molecule. Let's get into the key medications we use to target the actual neurobiology that underlies these conditions. SSRIs, or selective serotonin reuptake inhibitors, you've heard of them. They are an absolute cornerstone of treatment, and the way they work is actually pretty elegant. So a neuron releases serotonin into that little gap between cells, the synapse. Normally, a pump would suck that serotonin right back up, but the SSRI drug comes in and physically blocks that pump. It's like a goalie. This keeps more serotonin hanging around in the synapse for longer, giving it more time to do its job and regulate mood. Now, choosing between the older, typical antipsychotics and the newer, atypical ones comes down to this really important clinical trade-off. The first-generation drugs, they work, but they come with a high risk of some really awful movement side effects, what we call EPS. The second-generation drugs are much better on that front, but they introduced a new problem, a high risk for metabolic syndrome. We're talking major weight gain, high blood sugar, cholesterol issues. So the decision is always about which set of potential side effects is a better risk for that specific patient.
Pay attention here, because this is an absolute non-negotiable safety rule in psychopharmacology. MAOIs, or monoamine oxidase inhibitors, are really effective antidepressants. But if you're ever switching a patient off an MAOI and onto another drug that affects serotonin, like an SSRI, you must wait a full 2 weeks. This washout period is critical. It prevents a potentially fatal spike in blood pressure or serotonin levels. 2 weeks. It's a number that saves lives.
So we've talked about the mind, we've talked about the molecule. Where does this all leave us? Well, the final and frankly most important step is bringing these two worlds together. You know, this is the question people always ask, isn't it? Is mental illness a psychological problem you fix with therapy, or is it a biological problem you fix with a pill?
And the answer is, the question itself is flawed. It's a false choice. The best care, the most effective psychiatric care, understands that the mind and the brain are not two different things. They are deeply, intricately connected. The big takeaway here is that modern psychiatry doesn't choose between therapy and pharmacology. It weaves them together into one unified approach to care.
And we'll wrap up with this incredible quote from Sigmund Freud himself. It was this idea, the idea that powerful, unconscious forces are always at work inside us, that really launched this entire journey to understand the human mind. It's just a powerful reminder that this is an incredibly complex, fascinating field. And the quest to figure out how our own minds work, well, that quest is far from over.